guys, welcome back to my channel. I know it's been a long time since I posted, but I just wanted to come in because of the coronavirus hysterics. Today I had the opportunity to interview a professional nurse. She's been working in New York City for years, and I wanted her to explain her experience with coronavirus and maybe give my viewers some tips and pointers. I also wanted to have her viewpoints because of course we're hearing from the CDC, we're hearing from doctors, but I wanted to hear from a real woman, a real New Yorker, just one of us. And guess what? This woman is my sister, so I know she's going to give us the real. Please continue to watch this video. Hi guys, welcome back to my channel. As I told you, I will be interviewing my sister who works in a hospital in the Bronx. Say howdy.
Hi guys, my name is Tanya. I'm just here to give a little bit of information that can help all of us to deal with this coronavirus and keep us all calm so we don't all have to be in hysterics.
Alright, so I just want to remind you guys that yes, if you need any information, you can go to the CDC. They have all the information there for you. But I just wanted to get a nurse's viewpoint or nurse's opinion or just hear what she has to say about the outbreak right now in the Bronx. Anything you want to begin with?
Well, I just want to say that people don't need to get so wound up about it. I mean, we've had outbreaks before, so I just want people to kind of like just calm down a little bit, get the information, don't get too much information where you get overwhelmed, and just know that this too shall pass. Just follow what the local news is telling you, but you know, don't get too crazy.
It's recording.
So, Tanya, please tell me, since the coronavirus hit New York, have your daily procedures changed?
Well, really and truly, we have a screening now for when patients are coming in with symptoms that appear to be the coronavirus. And our organization, like many others, have placed steps in place so that people are processed through and try to keep them isolated as much as possible to rule out the virus before we, cause any extra exposure.
All right, and so far, have you had any experience with coronavirus at your hospital?
I work on a floor where we have a lot of immunosuppressed patients, so we wouldn't get anybody that has the coronavirus because we know that's a susceptible group to the virus, so we wouldn't let them come to the unit I work on.
Okay, but to your knowledge, has the hospital treated anyone for coronavirus?
We have a couple of cases of coronaviruses, and they're being taken care of.
Oh, okay, because I thought when I spoke to you yesterday, you said your hospital didn't have any.
Well, when I went in this morning, they said that at a number of different sites that we own, there are a few cases of coronavirus.
Oh, so it's not at your particular location?
No.
All right. I'm happy you spoke about your work procedures, but even at home, have you changed your lifestyle at all?
No, because we're a family that washes our hands after using the bathroom and when we feel like we need to wash our hands. When you go outside and you come back inside, you should definitely wash your hands. And, that's just a practice we always did. We always had hand sanitizer. We always bought big in bulk. So we never felt the need to run out and buy, anything extra.
All right. As a teacher, I say go to New York. Can you give me some hand sanitizer?
Well, now that we don't have the hand sanitizer and everyone's going crazy, at some stores you can't even find it.
So that's enough.
That's enough.
Okay. Okay. Since we spoke about your practices at home, what is your stance? Are we bathing twice a day again? For those who did it?
I feel like, my practices, I bathe twice a day. And the people in my household bathe twice a day. And I feel better bathing twice a day. But, that's everybody's hygiene, whatever their practices. But now that we have the coronavirus, if you were washing your hands and being thorough and you use hand sanitizer as, needed, then you should be fine. If you're a person that has a low immune system or the elderly, I would take precautions. I would really, be very mindful of where I am. I wouldn't go into crowded areas, and I would avoid the areas that the news is telling us to stay away from.
Okay, so the way you're saying it is the bathing twice a day or every day is how you want to practice your hygiene. Yeah. It's not something, because of Corona, I think you should bathe more.
No.
All right, thank you for the clarification. All right, so I got that question now. So you kind of touched on how has your hospital began to prepare for the corona epidemic. Do you think your hospital might be overwhelmed if we make it to the 30 to 100 million patients nationally?
Well, I feel like if we are mindful that, we probably don't know how much people have the coronavirus, but there's a lot of people that are going to get tested and are able to go home.
Mm-hmm.
So not everybody is going to need an ICU bed, Not everyone that gets it is going to need to be in the hospital. Some people will be able to go home and be quarantined and be fine. And then the people who do need to stay in the hospital, they will be able to facilitate them. I think if people are really, we want to get ahead of it, which they said that we're not, we're kind of behind it. It might be, but hopefully we'll be able to, stop it and it won't be as bad as it's forecasted to get.
Hopefully. All right. But you think in the Bronx we're prepared, and at the hospital you work at we're prepared?
I think that at my hospital, from the information, because things are changing every minute, every hour. The CDC is getting new updates. My hospital is getting new updates. At first they said we needed the N95 mask. Now we don't need the N95 mask. We could just do surgical mask.
Okay.
So that's a plus, knowing that we don't have to. Because people were just walking around with masks and we weren't sure if those masks were even helping to prevent the spread of the virus,
So, okay, now that you said that, so now that you realize you don't need this specific mask, you can use the regular ones.
Mm-hmm.
People who were walking around with the masks, were they actually helping?
Well, it looks like it was helping because they're saying that it's really like a droplet.
All right, but then I also heard that people that are coughing and they got on the mask is going to be oversaturated and you're going to still be spreading the germs.
Well, if your mask is wet and damp and soiled, you need to throw it away and get a new mask. You can't wear like the same mask for the whole day and it's soiled. I mean, because if you're touching the mask and all of that, then you put it back on, take it off, you're contaminating that mask with your hands if your hands aren't clean. Okay. So you have to be careful.
Okay. Since you work what did you say? You work on a floor where there's a lot of people with immune corruption.
They're immunocompromised, meaning their immune system is low. So they're at greater risk for just even the common cold can become a problem for them.
All right, because I was watching an interview with a doctor from, I think it was China. He was saying that at his hospital, he would not have normally worked in that area, but because it became such a big epidemic in China, he had volunteered his service to coronavirus. And my first question, would they ever call on you to volunteer, or would you be like, okay, you're going to move to this, or you're going to stay with your unit? Like, would they ever ask you to go and work with these patients?
Well, in my case, I'm not in like the pool of people the emergency response pool. I'm not in that pool, and they have people set aside to go to places when there's an emergency, and those are the people that will go there first. And in my hospital, because what I do is a specialty, the other nurses in my hospital don't know how to take care of my particular patient population. So I don't believe that they would call me if it got dire to go down there, because if we're not there to take care of our patient population, who from the hospital is going to take care of them?
Okay, that makes sense. But you're saying, okay, so not for you, but others, they'll first start with a volunteer, and then, like, if there's not...
I mean, I feel like they would have the people that are in the emergency response pool go first, and then if they needed people extra, they would ask people to come and volunteer.
All right. This same doctor I was telling you about, he was saying because he's now working with coronavirus patients, the hospital didn't want him to go home to his family and to his neighborhood and infect others. So they put him up in a place close, him and other doctors in a place really close to the hospital. Do you think your hospital is ready to that, or even the city is ready to that?
But like what I said before, that because we're getting the new information and everything like that, we know that once we wash our hands, we wear the protective mask, it's like taking care of any isolation patient.
Okay.
So we don't have to spend the night away from our family.
Oh, okay. Oh, all right, because he was dealing with it early on.
So they weren't really sure about what they were dealing with.
All right. So I feel like you feel confident about it, but I was gonna ask, are you afraid? But everything you're telling me, it seems like it's like everyday work for you.
Yeah, I mean, I'm not afraid. I just think that we need to listen to what the CDC is saying and just wash your hands and be more mindful. If you are elderly, if you're immunocompromised, stay away from large crowds. Wear your mask. Everybody doesn't need to wear a mask. People who are perfectly healthy stay away from crowds as well, but you're a healthy person. If you see somebody coughing, they need to cover their mouths. People need to have cough etiquette. You cannot be in a crowd and just coughing everywhere, and wash your hands.
I am a teacher, so I feel as though I could be hysterical about the situation, but I feel because I'm a teacher, it's inevitable for me or someone close to me to get it.
Well, because you have a lot of kids, and kids are, they don't pay attention. They play in their face, they cough into the air, they don't care, they don't really wash their hands all the time, and they're in a big group. And the parents are at home, they could bring something from home to you. It happens all the time. When
Exactly.
people have lice or people have chicken pox, the whole class gets chicken pox. So, I mean, what you have to do, you have to announce to the kids, wash your hands before you eat. Wash your hands when you come back to the class. Wash your hands after you use the bathroom. It's annoying, but that's where we're at right now.
Thank you.
And remember, guys, wash your hands and cough into your elbow.
Thank you. This is my sister, a nurse, and she wanted to drop some knowledge, and I thank you. Thank you. I would shake your hand, but you're a
No,
nurse.
we do this. All right. That's it, right?
So now that we have completed the interview with Tanya, if you want to see more like this, put it in the comments. I'll continue to give more information about the corona as she gets there. Maybe she'll come back and visit us again and give us some tidbits. Please don't forget to like this video and subscribe to my channel. Please share with your friends, family, whoever you think needs to hear this information.